I think particularly now with all these advances in treatment for multiple myeloma, a focus should increasingly be on the elderly patient population, because we know that more than 3/4 of patients are diagnosed over the age of 75. So we were talking about standard of care regimens for patients with non-transplant eligible newly diagnosed myeloma, and Alessandro Larocco was talking about frailty assessments. So we have now an increasing number of tools for assessing frailty in patients. What we don't know yet is which one is the best to use, and also how to use them optimally in order to stratify how we treat patients and to modify our treatment regimens. So the fitness study in the UK is trying to answer those sort of questions. We also have new tools for assessing frailty, for example, sarcopenia, and really understanding the contribution of physical fitness to frailty. The standard of care regimens for newly diagnosed myeloma are, of course, outstanding today. Dara-Lendex is able to give a progression-free survival of 60 months, which I think is outstanding for those patients. So a great deal to look forward to for newly diagnosed patients who are not eligible for transplantation. But of course, the patient's perspective is key here, really. We have to understand patients' priorities and their goals, and the perspective is influenced not only by their understanding of the disease, but also their perception of what treatment can offer, what the side effects might be, their cultural background, their families and loved ones, and what they hear today. We hear so much on the internet, and patients lay great store by stories, and patients other people's stories on the internet. Finally, their spirituality. That is very important for patients, and obviously for some patients and not others. But there was a good study from the King's College Group in London in the UK that looked at patient priorities, really asking patients what matters to them. And 3 broad areas matter: emotional approach, secondly, activity and participation, and thirdly, the amount of support patients get from the clinical team and from their family. So I think in summary, although we have great advances in treatment regimens for newly diagnosed patients, these older ones, it's important to remember to ask patients what their priorities are, to agree mutually agreed goals for treatment, and to make sure patients understand what the treatment side effects might be, and also have a realistic expectation of disease response and what the future holds for them. Thank you.